The men who stay and live at Seaton House have been dealing with a Strep A outbreak for 8 months. And still, after 8 months, the highly contagious and often dangerous infection isn't over.
The good news is that we haven't had any new cases of the outbreak strain at Seaton House since October 3rd. So the outbreak has come under good control over the past several months that we've been working on it with Seaton House.
Toronto's largest homeless shelter, which can house over 500 men at any given time, first experienced the outbreak in March. Over 50 men caught the highly contagious disease, and even today, the community isn't in the clear.
Our clients have, complex chronic health problems. So they get better, they do okay, they don't show signs of Group A strep, and then something hits them, and then they're sick again.
Strep A often results in no more than a sore throat, but among certain populations, it can lead to flesh-eating disease, pneumonia, and even meningitis. Toronto Public Health has not officially called the outbreak over, and that's a concern for Joyce Rankin, a registered nurse with Street Health.
People are chronically ill there, and they're going to be transferred to other local hospitals, and then you worry about bringing in Group A strep to the other organizations.
Equally problematic is the impact the outbreak has had on Toronto's shelter system, which was at 97% capacity yesterday.
The impact of the outbreak is the closure of 103 beds.
That's over 6% of the city's male beds. Those beds were used by some of the 50-plus men in the non-emergent shelter program who developed Strep A.
We want to make sure that it's that basically that we don't see opportunities to build up that infection again.
But some believe it didn't have to escalate to the levels it did.
There's been communication issues across the board. Some community agencies didn't even get the notices that there was an outbreak.
Which means they continued to serve clients in and refer them to Seaton House. TPH acknowledges prompt notice was an issue.
It took us some time working with Seaton House to identify who those partners are, who needs this information.
Sashadeva says lessons have been learned, and she's confident TPH can contain future contagious infections and diseases.
It was, early on a learning curve in terms of how to manage this outbreak in this type of setting.
The city's shelter support department says those critical 100 beds will not be put back into the system until those 50 patients have been deemed clear and the infection officially contained. On George Street, Cristina Howorun, City News.